Hello, PCA members. This is former President Dr. Keith Miller. I am in Washington, D.C. I got a short video, if you got about 2 minutes, to talk to you about advocacy and why it's so important when you're pissed off about the system to get up, stop complaining, and go do something. So this weekend, myself, former president of the PCA, Dr. Dan Schatzberg, who's also the rep from Pennsylvania to the American Chiropractic Association, PCA member Paul Duffy, our executive director Mike Barba, several students and some other chiropractors from Pennsylvania, as well as 49 other states of chiropractors, came down to Washington, D.C. for Engage 2025, which is an ACA sponsored event in which we basically descended on Thursday onto Capitol Hill. We visited all three of Congress's buildings, and we visited 16 of the 17 congressional member offices. Now, if you remember, the PCA was successful in the last several sessions at getting 16 of the 17 members of Congress to sign on to the Chiropractic Medicare Modernization Act. And that act, very simply, will give you full scope under Medicare. Your exams, your x-rays, your therapies, your patients will finally have access to all of those in your office paid under Medicare, under the Medicare fee schedule. And remember, where Medicare goes, the rest of the country goes. So when you're looking at some of these plans that are restrictive and they basically say, well, Medicare doesn't cover it, things like the Advantage plans, Keystone Health Plan East out of IBX in the southeast part of the state, et cetera, this is a game changer. This will be federal parity for doctors of chiropractic who've been discriminated since 1972 when Medicare first allowed chiropractic into the system. This will be a major improvement for all of us, for our patients' lives, for access, for affordability, and it's just a good thing. I mean, why wouldn't you want the disabled and the seniors of the United States to get the same care they had when they were 62 on their commercial policy now that they're 65 and need more care? Let's keep them off of opioids and surgery and disability. Now, I am in Commander's country, and tomorrow they're going to drive up to Philadelphia, where the Eagles will hopefully kick their ass in the last round of the playoffs, but I digress. But I wanted to talk to you about why it's important for advocacy. Out of 180 Congress members that signed on to this last session, 16 of them, almost 10%, came from Pennsylvania. Why? Because Pennsylvania really did a great job of advocacy. What that means is people have to start making friends with their representatives. Now, obviously in Congress, it's a little bigger deal, but all of you have a local rep. That local rep is in Harrisburg, but they have a local office probably 5 to 10 minutes or even walking distance to your house. And what I need you to do, and I really don't give a poop, See, I didn't swear, but I wanted to. I don't give a poop. If you're a Democrat or Republican or you're purple or green or what you identify as, I don't care. You are a DC. You vote DC in Pennsylvania. And I want you to figure out who your elected representative is in your area. And I want you to spend $50 or $100 and go to one of their meet and greets coming up this spring. I want you to go there. I don't want you to ask for anything. I just want you to go, pay your $50, say hi, thank you, representative, you're doing a great job. My name is Dr. So-and-so, and I would love to sit and talk to you at some time when you have more time and all these people aren't around to talk to you about some of the healthcare crises going on in Pennsylvania. And then shut up. And then follow up with their office about 2 weeks later, and then go to meet them when they are not in Harrisburg, when they are, like I said, 5 to 10 minutes or walking distance to your home. And what you're then going to do is talk to them about the problems in healthcare going on for your patients. Not for you, not for this, not for that, but for your patients. How high copays have made it that people have to decide between care or groceries. And because they can't afford the care, because their copay is higher than the reimbursement, they're going on opioids, which become a blight to the system, eventually become addicted. They wind up having to go to rehab and all the other things that happen. Talk about, the ridiculousness that people are buying and paying for 20, 30 visits on their plan, but the tiering systems and the pre-authorizations are making sure that they can't get more than, as UPMC would tell you, 7.25, as Ashland would tell you, 6.5, as Highmark would tell you, 8. But all these companies are, regardless of what these people pay for, regardless of their medical necessity, are being denied the care that they pay for. And talk to them about these things. And remember, the PCA has 3 bills. One is released, 2 more are coming. And the first one is delegation. We're trying to restore delegation that was taken away from the Kavoda versus State Farm case. We got really close last session. We should get closer this one. But to restore delegation so you could do therapeutic exercise with trained staff in your office, but unlicensed. But we want to get that back, and we've been working hard. So look for that bill. We already had previous versions out, but the new one should be coming soon. Next is the copay bill. The copay bill is going to be a game changer. Why? Because it's going to say that you can't have a copay over a certain amount. Delaware has restricted it to 20%. Ohio, just a few weeks ago in December 2024, passed a bill that says you cannot charge a copay for chiropractic higher than a PCP. We have tried similar legislation in the past. We're probably going to wind up having to do it as a percentage, and this will be 25%. So if you charge 100, they say that you can only get 60 out of that. Well, the patient doesn't have to pay more than 25% of that 60. Additionally, so they can't screw us even more and try to just play games, they won't be able to charge us under this bill that we're trying to pass less than what the Medicare allowed fee schedule would be. So that's a big game changer, because what it will do is make chiropractic care more affordable. So people will, instead of opioids, surgery, and all sorts of things that don't work and create long-term disability, can get chiropractic care, pay for it affordably, and save the entire healthcare system money down the line by properly getting the care when the problem occurs so it doesn't become chronic. The last bill, and the most important bill, will be the Pennsylvania Scope Modernization Act. Yes, you heard me. Our scope is ridiculously old. It was started in the 1970s. It was updated briefly in 1985. When the adjunct license came in, we had a tiny little tweak when we added the ability to delegate stuff to students. This way we were able to get University of Pittsburgh to open the school. But besides these little changes, we are essentially on the same scope for about 70 years now, which is absolutely ridiculous, and we are falling behind the rest of the country. Things like animal chiropractic, dry needling, certain things for pregnant women. We don't have sideline care, concussion management for our student athletes, return to care. All these things will be addressed in the upcoming Scope Modernization Act. Now, why am I telling all this, and why am I doing it with the capital behind it, and why am I going through all this? Because I want to remind all of you that this only happens through advocacy. And what that means is that when our bills drop, it doesn't matter how good the bills are. It doesn't matter how much I go to Harrisburg and how much I go blah, 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 blah. I'm Dr. Miller from PCA, blah, 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 blah. Nobody cares. What they care about is grassroots. We've all heard the word before, grassroots. And what grassroots means is you and your staff and your associates and the people you know, like, and trust need to get off of your tushies. See, once again, I really wanted to swear, but I'm keeping it clean for everybody. But you got to get off your tushy, and you got to go make friends with your local representatives. And when they know, like, and trust you, they will listen to your message. And when your message is sound and safe, and it's good for their constituents, and it saves money to the system, it's really a no-brainer. But you have to know these people. You can't just show up one day and start going blah, 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 and you have no idea who you are, and you're just one more crackpot coming in. You've got to make friends with them. Not D, not R, not XYZ. You vote DC. And when you make these friends and you put the work in, things will change. And if every single one of us, and there's about 3,900 plus of us in the state, if the vast majority of us get off our butts and go and make these friends when our bills are out there, and all y'all start walking into these offices in mass, guess what? These 3 bills will pass very quickly. The other thing I need you to do, besides make friends in these and go to these very inexpensive meet and greets to get some access and make some political connections, is to donate to the PAC, the Political Action Committee. We all know how PACs are used. We all saw the millions and the hundreds of millions of dollars that flowed into PACs for this last presidential election. The political action committees are what sway politics, because money and politics are basically like salt and pepper or chocolate and peanut butter. They go together and there's no way they're coming apart. So you need to donate to PAC. Now, I'm not asking big commitments. Now, if you have a practice that's making 7 or 8 figures, I'm going to ask a slightly bigger ask of you. If you're making millions of dollars off of your profession, I think it's a small ask that you take a couple $1,000s, a couple $100, $50 to send to the PCA PAC. If you are a small office, you know what? You want to sign up an auto pay of $5 a month, $10 a month, $15 a month, $25 a month, whatever you could spare, your latte that you're giving up once a month, send that money into the PCA PAC, because that money, 100% of it, not a single dollar is being wasted, goes to one thing and one thing only: political activism to pass our 3 bills that I talked about earlier. So I know this was a long video. It was a lot longer than I promised at a couple minutes. It's about 10 minutes now and still going. But this is important. This is your future. This is the legacy. So if you're a new student, you just got out or you're in practice for a year or two, essentially these are going to change the rest of your life in practice. If you are a successful doctor or a retiring doctor, it's time to give back. The profession was good for you, and it's getting worse for the people in the future. And if you want chiropractic to thrive into the future, this is what is going to sustain us into the future. So please help me, help the PCA, help you in your practice. Please, I urge you, make friends in Harrisburg, make friends in Washington, donate to the political action when you have friends that you talk to. If you're a member, please talk to your non-member friends. If you're a non-member watching this, I don't want to shame you, but we're doing all the work and you're getting all the benefits. And to be a member of the PCA is $50 a month. It's one adjustment a month. Think about what would happen if we got Medicare parity. Think about what would happen if we got full scope. Think about what would happen if we were able to get these copay bills passed and your reimbursement brought up. Is it worth $50 a month? I don't know to you, but it's worth tens of thousands of dollars in saved dollars to my patients, and I don't have to struggle as hard, and I can then be able to pay my staff better, my associates better, my life would be better, everything would be better. So please, I urge you, watch this video, send it to your friends, become part of the solution, stop complaining about the problems. This is Dr. Keith Miller, former president of the Pennsylvania Chiropractic Association, thanking you for the 12 minutes of listening to me ramble. Bye, everybody. Go Birds.